Welcome back. Your current time is 5:45 this morning, and it is back to work for the Rhode Island Congress as they gavel back in for the session this year. It is the same in Washington, D.C., where the House of Representatives will convene for the second session of the 119th Congress. The Senate previously convened on Monday. The House is poised to vote on extending newly expired Obamacare subsidies. The issue is a priority for Democrats, and some House Republicans have broken ranks to push the matter. Congress also must decide how to respond to President Donald Trump's removal of Venezuela's Nicolas Maduro. Meanwhile, House Republicans are pressing on with a slimmer majority than last month as Congresswoman Marjorie Taylor Greene of Georgia resigned effective Monday. That leaves the House with 219 Republicans and 213 Democrats and 3 vacant seats. The GOP total is set to contract even more when 2 Democrats face a special election runoff in Texas this month. Meanwhile, the Trump administration has announced the freezing of billions of dollars in money for child care and other services. As ABC's Christiane Cordero reports, the White House says it's due to fraud concerns affecting multiple states.
This morning, the Trump administration says it's cutting off $10 billion in funding for child care and social services in 5 Democrat-led states. Administration officials tell the New York Post the freeze is over concern that benefits were fraudulently funneled to non-citizens. Funds are being suspended in California, Colorado, Illinois, New York, and Minnesota. The programs help subsidize child care for low-income families and provide cash assistance for the poor. The move comes days after the administration said it would pause child care funding to all 50 states, with funds being released only when states prove they are being spent legitimately. The 5 states named yesterday are being asked to provide attendance records and inspection reports. Some facilities in Minnesota could face even more requirements.
The state of Minnesota has allowed scammers and fake daycares to siphon millions of taxpayer dollars.
A video posted last month by a right-wing influencer claimed several Minnesota daycares receiving public funds were not actually providing child care. The video focused on daycares in the Somali community. State authorities have investigated the allegations for years and say investigators have been sent to 9 centers referenced in that video last month, and children were present at all except one, which was closed for the day. Still, the Trump administration is ramping up enforcement. Up to 2,000 federal agents could be headed to the Minneapolis area to conduct immigration and fraud investigations.
Christiane Cordero, ABC News, Washington.
Christiane, thank you so much for that report. It's 5:47 as we turn now to some headlines for your health. Flu cases in the U.S. have reached their highest in 25 years. All but 4 states are at high or very high levels of flu. A new strain is responsible for the spread. It began to spread after strains were chosen for this year's flu shots, which means flu vaccines only offer partial protection against it. In terms of severity, the number of people hospitalized due to the flu is not a standout, but doctor visits for flu symptoms haven't been this high since 1997. In light of increasing flu and respiratory virus cases, Brown University Health has moved its virus status to red across all facilities. Now, what that means for you, surgical masks are now required for all patients, visitors, and staff. Masks will be provided to patient family members and visitors when they arrive, and they will also be available in patients' rooms. And at 5:48 this morning, we want to make you aware that upcoming guidance from Health and Human Services is expected to keep many child vaccine recommendations intact, including measles, polio, and chickenpox, after it cut recommendations for RSV, meningitis, and hepatitis, except in kids who are at higher risk. The policy brings the U.S. closer to how developed countries like Denmark handle vaccines, but some experts worry it could lead to more preventable infections in children, and they say it's not a good comparison because people in Denmark have easy access to mostly free health care.